Tourette's syndrome is a certain brain defect. Tourette's is a hereditary neurological disorder. You are born with it and it causes you to tick. Ticks control your body. Ticks are like a sneeze. You just have to do it. There is no relief unless you do it. There are motor tics such as twitching, kicking, blinking, or shaking. Verbal tics include coughing, yelping, throat clearing, grunting, and yelling. Cursing, uttering obscenities, and ethnic slurs are manifested by fewer than 15% of people. Too often, however, the media seizes upon this symptom for its shocking effect. Tourette's syndrome is defined by multiple tics lasting more than 1 year. The first symptoms are usually involuntary movements of the face, arms, or limbs. These tics are frequent, repetitive, and rapid. The first common symptom is a facial tic, an eye blink, nose twitch, or grimace, and is replaced or added to by other tics of the neck and limbs. About 1 in 1,000 people have Tourette's. All ethnic races can have Tourette's, but boys have it 3 to 4 times more than girls. Tourette's can come along with associated conditions like OCD, learning disabilities, sleep disorders, and attention problems like ADHD or ADD, and impulsiveness and oppositional defiant disorders. Although the cause of TS is unknown, certain current research points to abnormalities in certain brain regions, including the basal ganglia, frontal lobes, and the cortex. The circuits that interconnect these regions and the neurotransmitters, dopamine, serotonin, and norepinephrine, responsible for communication along the nerve cells. Given the often complex presentation of TS, the cause of this disorder is likely equally complex. Diagnosis is made by observing symptoms and evaluating the history of their onset. No blood analysis, X-ray, or other type of medical test can identify this condition. The TS symptoms usually emerge between 5 and 18 years of age. While there is no cure, medications are available to help control TS symptoms. They range from atypical neuroleptics to neuroleptics to anti-hyperactive drugs to antidepressants. Individuals react differently to the various medications, and frequently it takes some time until the right substance and dosage for each person are achieved. Almost all the medications prescribed for TS treatment do not have specific FDA indication for the disorder. The condition in many individuals improves in their late teens and early 20s. As a result, some may actually become symptoms-free or no longer need medication for tic suppression. Although the disorder is generally lifelong and chronic, it is not a degenerative condition. Individuals with TS have a normal life expectancy. TS does not impair intelligence. Although students with TS often function well in the regular classroom, ADHD, learning disabilities, obsessive-compulsive systems, and frequent tics can greatly interfere with academic performance or social adjustment. After a comprehensive assessment, students should be placed in educational settings that meet their individual needs. They may require tutoring, smaller specialized classes, and in some cases, special schools. Research of TS and its cure come from studies across a number of medical and scientific disciplines, including genetics, neuroimaging, neuropathology, clinical trials, medication and non-medication, epidemiology, neurophysiology, neuroimmunology, and descriptive diagnosis clinical studies. Dad! Cara, what are you doing? I made it stop. Although tic symptoms tend to decrease with age, it is possible that neurobehavioral disorders such as ADHD, OCD, depression, generalized anxiety, panic attacks, and mood swings can persist and cause impairment in adult life. Most people with TS and other tic disorders will lead productive lives. There are no barriers to achievement in their personal and professional lives. Some have even gone on to be surgeons, psychiatrists, teachers, executives, and professional musicians and athletes. It's a good story. Involuntary movement of mouth, tongue, and lips. A compulsion to pull out one's own hair in order to relieve anxiety. Involuntary repetition of words or phrases said by others. Repeatedly saying one's own words or phrases. Abrupt, quick, jerky movement of the head, neck, arms, or legs. Involuntary utterances of obscene or inappropriate statements or words. Compulsive mental counting. I said it. Yeah.
Okay. I had an idea.
I have compulsive mental
You should sit there with.
These tics are frequent, These tics are frequent. I can't say this word.
What word?
Repetitive.
How is it spelled?
Repetitive. Frequent, repetitive.
Repetitive?
Repetitive. There we go. Thank you. 1, 2. Compulsive metal counting.